Good morning, everybody. If you're just joining us, thank you for joining us. We will wait maybe 3 more minutes, something like that, so others can join as well, and then we will start at 8:01 in the morning. Are you glad, Senator Barto and Representative Shah, that you're having a couple days of a break, or would you have rather gone through and maybe even potentially work over the weekend just to get this thing like wrapped up?
Oh, I always prefer to wrap it up. But today won't be a short day for us. We're planning to vote the budget out on our side and then, work with the House as they move along too at their pace. If we have the votes, so we will see where we are. But yeah, I'm anxious to get back to regular life. I think we've done a lot and it's time.
Yeah, I think a lot of
I,
people. Yeah, go ahead, Dr. Shah.
I think many people want this thing to get over and done with, but we have to try to come up with the best package for the state of Arizona and its people. My understanding is that the communication we received last night was that we were adjourned for some time, for a couple of weeks.
Again, good morning, everybody. If you're just joining us, thank you for joining us. We're going to wait maybe just 1 more minute, and then we'll start today's morning scoop.
They're painting our building outside, so if you hear a lot of background noise all of a sudden,
Yeah.
that's what's going on.
No worries, Senator Barto. I think I've had worse.
Okay. No barking dogs though, so. I'm anxious to get back to Alexi's for morning scoop. That's what I miss.
The breakfast there is incredible.
Yeah.
They have feta cheese and all kinds of good stuff.
Any chance we can do that pretty soon?
Yeah, I'm closely watching the numbers, and I think in my mind, or at least I have some kind of a number that I'm looking toward, and when we hit that number, I think we can start going back to Alexis. I think we're going to start. Good morning again, everybody. Thank you for joining us this morning. My name is Luigi Del Puerto. I'm the publisher and editor of the Arizona Capital Times. The Arizona Capital Times, of course, covers state government and politics. And if you don't have a subscription, you're really missing out on what's going on politically in the state. Send me an email, call me, text me, tweet at me, and I'll get you squared away. We have a very big subject this morning. As more and more Arizonans get vaccinated, Americans get vaccinated, life slowly returns to some kind of a normal. But of course, healthcare challenges, notably around behavioral health, persist. Many children, for example, have not physically interacted with their friends and classmates for a year. And the questions are, what are the potential lingering effects on their mental health? And how can parents and others help them? What about other vulnerable populations, or elderly population, for example? What can families really do to prepare as American society starts to emerge out of this pandemic? We will talk about all of those this morning, but first I want to thank Molina Healthcare, of course, for sponsoring today's morning scoop. And my apologies, let me just pull up my notes here real quick, because I had that in front of me and then I lost it. Again, my apologies for that. Of course, Molina Healthcare is a Fortune 500 company that provides managed healthcare services under the Medicaid and Medicare programs and through the state insurance marketplaces. Through its locally operated health plans, Molina Healthcare serves approximately 4.6 million members as of March 31 of 2021. Molina Healthcare's story is about one man's belief that when it comes to healthcare, everyone should be treated like family. It was in 1980 when, as an emergency room physician, C. David Molina noticed that low-income, uninsured, or non-English speaking patients were coming to the emergency room in need of general healthcare services. Without family doctors, they were not always getting the right care and information. These underserved families deserve better, and Dr. Molina then set out to do something about it. He opened a clinic in Long Beach, California, to provide low-income individuals and families with a place to go to get personalized healthcare from Molina doctors. 2 more clinics opened that same year, and today Molina Healthcare serves people across the country through various lines of businesses. And here to welcome us this morning is Minnie Andrade, who is the Chief Executive Officer of Molina Complete Care of Arizona. Minnie is responsible for the management, performance, and quality outcomes of the health plan. She is widely known for a strength-based collaborative leadership style, which cultivates an innovative, member-centric, and solutions-based health plan for Central Arizona. Minnie, who first joined Molina Healthcare as a consultant back in 2017, brings 20 years of experience in healthcare and executive management. Prior to joining Molina Healthcare, she was a managing partner with 32nd Note Consulting, where she provided leadership and operational expertise to Medicaid and Medicare health plans across the country. Additionally, she served as COO and Chief Customer Officer with Phoenix Health Plan. Minnie?
Thank you, Luigi. I appreciate that. And good morning, everyone. Welcome to the Arizona Times Morning Scoop. On behalf of Molina Healthcare, we thank you for joining this really important topic of COVID-19 and mental health resilience, a topic that we are very much interested in. We hope you find the next hour informative, as this topic is critically important for our community, and we've got a good group of folks here that will talk through some of those key issues. Again, welcome to the Morning Scoop, and enjoy this next hour.
Thank you, Minnie. We have a great panel this morning. Joining us is Senator Nancy Barto, who chairs the Senate Health and Human Services Committee and represents Legislative District 15. Senator Barto has resided in Arizona since 1962. She and her husband, Joe, have been married since 1978, and they have 3 daughters and 3 grandchildren. Senator Barto studied vocal performance and elementary education at Arizona State University and at ASU West. Senator Barto served in the State House of Representatives for 5 years before her election to the State Senate in 2010, representing also again Legislative District 15, which encompasses North Phoenix and Northwest Scottsdale. She focuses on healthcare and family-related issues at the state capitol. She has sponsored major healthcare reforms aimed at increasing affordable health insurance options, protecting patients' fundamental privacy rights, and of course, advocating for the health of women and children. She recognized as a consistent leader for Arizona families. She has championed important medical tort, property tax, and homeowner reforms, and she has been a voice for reform in Arizona foster care and behavioral health systems. Prior to public service, she enjoyed a career as a mother, school and community volunteer, and public policy advocate for family issues. She enjoys hiking, the arts, and of course, time with the grandkids. Senator Barto, thank you for joining us.
Thanks, Luigi. It's an honor to be here.
Also joining us this morning is Representative Amish Shah, who is also a doctor. Representative Shah represents Legislative District 24, the child of immigrants. He attended Northwestern University in Evanston and graduated cum laude with a Bachelor of Arts in Economics. He then graduated from Northwestern University Medical School as part of the honors program in medical education. After medical school, Dr. Shah worked for an international strategy consulting firm. He then completed a master's in public health with a full merit scholarship at the University of California, Berkeley, followed by residency training in emergency medicine at New York City's busiest Level 1 Trauma Center. He won the American Academy of Emergency Medicine's National Resident Research Competition for his work in inventing a new method to provide care for the critically ill. Representative Shah taught medical students and residents at the Mount Sinai Medical Center in New York, of course, as a full-time faculty member as an academic researcher. And amidst concern over the potential catastrophic injuries, he helped the NFL improve their emergency management through research and presented his work at the NFL Physicians Society. Dr. Shah is also a graduate of University of Arizona Sport of Medicine Fellowship. And of course, outside of his medical practice, he founded the first Arizona Vegetarian Food Festival as a philanthropic endeavor to promote healthy eating and eliminate preventable disease. Representative Shah, thank you for joining us this morning.
Thank you for having me.
Also joining us is Joel Conger, who is the Director of System Transformation at Magellan Complete Care of Arizona. In his current role, Mr. Conger's primary responsibility is community outreach and population health, focusing on identifying social determinant trends within Magellan's enrolled membership and working to address gaps in care. Prior to joining Magellan, Mr. Conger served as the Vice President of Healthcare Strategy at Crisis Response Network, and he also received his master's degree in business administration with emphasis in healthcare from the University of Phoenix in 2001. He has a bachelor's degree in psychology from the University of Arizona, which he graduated from in 1993. Joel, thank you for joining us.
Thank you for having me.
Also joining us is Joshua Sprunger, who is the Individual and Family Affairs Administrator at Molina Healthcare. Joshua leads Molina Healthcare in supporting health systems and partnerships that incorporate the power of lived experience, social determinants of health, peer and family support, and of course, harm reduction. He holds a certification in international peer support, and previously he was the executive director of NAMI, Indiana. Did I pronounce that right?
You got it.
Perfect. And which is a statewide organization improving the quality of life for those affected by serious mental health conditions. At NAMI, Josh spearheaded the grassroots advocacy and training for leaders who ran mutual assistance, community education, and support programs. Joshua, thank you for joining us this morning.
Thank you so much for inviting me.
As I mentioned, we have a big subject to talk about this morning. But first, I want to ask Senator Barto and Representative Shah to give us an update about the state budget, which it looks like it's not going to happen this week. Senator Barto, I guess I'll start with you.
Well, thank you. Well, your guess is as good as mine when we will actually sine die or end session, but it looks like we're getting close, but we're not quite there. The plan in the Senate is we do plan to vote the budget today, so it may be a pretty long day. That's assuming all the votes are there and on the floor. But then we will recess until we have more of an agreement with the other chamber, the House, and then we'll finish up. In some ways, I think we're close, and then depending on who you talk to, it might be a while. So hopefully soon we'll see an end. And I think it's just tough. You've got people on both extremes, too much spending and not enough spending, and so we're just trying to hit that sweet spot.
Thank you. And Representative Shah, what from your point of view, what's been the biggest holdup in the efforts to pass a state budget?
Well, I'm just going to tell you that what I hear are rumors. You hear that there are some sticking points, and I think that some of those rumors I even hear from your publications. So I'll just say that I understand that there are some big things in this budget. The flat tax. Some people are even interested in bringing back the voucher issue. I know those are controversial, and sometimes those are the sticking points you hear. And then little various projects that also people want included in the budget. So you hear all these rumors, and people want to have their priorities met, and that's kind of part of this process. So that's
what I'm hearing is that it could either happen in the next couple of days or in the next couple of weeks, something like that. We just don't really know at this point.
I mean, my understanding, so last night we were given a communication that we would not be back until June 10th. We were told that the House was adjourned until June 10th. I know that some of our members in the House will not be physically present for other reasons, for family obligations and such. So that might be part of the reason why we might be delaying for a couple of weeks.
Perfect. And of course, we will keep watching what goes on in the state legislature, and for our viewers and to our listeners as well. If you want to send in your questions via the Q&A box or the chat box, please go ahead and do so. We will try to get to as many of them as we can, during this program. I want to ask Josh. I've been watching very closely the number of COVID-19 cases in Arizona, and it seems like the trend line is going down. And I'm wondering if you are seeing the same thing in your hospital, in your healthcare system. How are you managing? How's Molina Healthcare managing during this pandemic? And what are you seeing generally in terms of our ability to potentially really emerge out of this pandemic at some point?
Well, and I think Joel can speak to this too, from a population health perspective. But, I think, our leadership and our chief medical officer are watching the cases every day and giving us updates about about what's going on. And we're seeing the same thing in our health plan that I think many are in the system, and that cases are going down, and people are engaging in in-person services again. And both of those things are really welcome trends.
Joel?
Yeah, I totally agree. You know, the barometer that we're using is really looking at the utilization of telehealth and telemedicine. You know, as the pandemic began to peak, we saw, much like probably all of the other health plans, a significant spike in the use, or a significant increase. Spike has a different connotation. Increase in the utilization of telehealth services, and fortunately, you know, with supportive access and you know, the other powers that be, we were able to shift pretty quickly to fill those gaps that were being created by the lockdown. And as you know, things are starting to improve, we're starting to see that corresponding reduction in the use of telehealth services, and folks getting back to in person. But I can tell you, the flexibility and latitude that we were provided to open up those telehealth services were invaluable to ensuring that our members were able to continue to receive the care they required. So fortunately, you know, I think to your question, we are seeing some of that level out, but then again, we've really been able to see some benefits to the flexibilities in opening up telehealth, in terms of, you know, historically in the behavioral health population, you would see like 35-40% no shows in any given practice, but telehealth has really closed that gap, and our providers are able to see more people, and you know, ultimately more people are able to be have their needs tended to. So,
And we will delve into telehealth in just a little bit. I want to go to Dr. Shah. Dr. Shah, you're an emergency room physician. What are you seeing, sir?
So in the emergency departments, we have actually seen an increase in volume that is not COVID over the last couple weeks. Really, I think it coincided a lot with that CDC announcement. And I think people started to use that as a signal to say that they felt a lot more comfortable to go out and seek care in person. Myself, I work in the emergency department at least once a week, and I continue to do that throughout session. So I can tell you that the number of COVID patients that I've seen is now fairly rare. In January, every other patient that I saw was COVID, and today I see one patient maybe every couple weeks or something like that. But the number of patients overall, the volume, I was actually speaking with an emergency department director just a couple days ago, and they were talking about how after that announcement, they saw a huge jump in volume almost immediately after that. So volumes are returning for in-person care.
Yeah. When you say CDC announcement, there's been a couple. Which one are you referring to exactly?
There was the announcement that they didn't believe that the scientific evidence had demonstrated that masks were no longer necessary for those who were fully vaccinated, and that same thing with the social distancing requirements for people indoors. So I believe that was 2 Thursdays ago, if I'm not mistaken.
So then what happens is that that signaled to people that they're safer to go out into the public. And of course, there's been pent-up demand because people have held back on getting their medical care. And so you're seeing some of that overflow into the emergency rooms.
Yeah, certainly. I mean, we're seeing increased volumes, yes.
Did you say increased fallings?
Volumes.
Volumes, okay.
Patient
okay.
volume.
Yeah. And Senator Barto, what are you seeing in your district as well, ma'am?
Well, I'm seeing normal, and that's good. You know, I think we're all looking at around us, and people are, as we mentioned in the pre-program. People are out shopping, dining. They're doing life a lot more normally now. I think parents are raising their voices at their school boards to send the message that they don't want their kids masked up. They're ready because they feel safe. And I think this is a great sign. Traffic is bad again. And, for better or worse, we're dealing with that. And so I see good signs on physically. I'm more concerned about, the lagging problems and kind of quarterbacking what we just went through. But I think, what we're seeing now is very positive on every score.
I want to talk to you about again, I want to ask Joshua and Joel about what we have learned, specifically from your end as a healthcare provider in the last year in dealing with this pandemic. You mentioned, of course, the advantage that telemedicine has provided people. I want to talk to you about that, Joel. When you mentioned that you've been given flexibility in the area of telemedicine, what flexibilities are you referring to exactly?
Specifically prior to the pandemic, telemedicine, it was fairly regimented in what services were able to be provided. Whether it was acute medicine, like the teledoc functionality, and to some extent, behavioral health services were able to be provided. But as the pandemic worsened, there were flexibilities to allow things like outpatient case management to be able to be done via telemedicine, which historically has been a face-to-face or an office service. Lower levels of outpatient counseling and treatment, where those restrictions were loosened so that folks could receive that service from the safety of their homes. In some instances, although probably not as effective as we would like, there was virtual groups that were being held, so that group therapy modality was something that was opened up. So again, it was a lot of very quick decision making that I think in most cases yielded an incredibly much better outcome than we could have been looking at had those flexibilities not been put in place.
So what you're saying is there were restrictions surrounding what you can actually offer via telemedicine. And for example, you're not necessarily able to offer or do case management, right? So these
Correct.
are just usual, regular doctor visits that previously were done in person, and now you've been allowed to do that. Senator Bartow, is that the result of decisions at the state level?
Is that the result of what? I missed that.
Are those a result of decisions at the state level, either at the legislature?
Yeah, definitely. Arizona's been a leader in telemedicine, and this year we took another big jump forward in making sure that it's expanded to the nth degree, really, to I think make sure that it's available appropriately, and had the right guardrails around it in order to make sure that it's not being done instead of in person, when in person is the most appropriate time. Thing that's needed for a specific patient and their treatment, and that the payment issues are addressed, that insurance can't, and physicians can't game the system in some way. So it was a very complicated bill, lots of give and take along the way until I think we've solved every issue. It was a big lift this session, and I think again, Arizona's leading in this. Telemedicine is the future in a lot of ways, but again, I think there are limits to what to who and how it is most beneficial for. And so we want to make sure that that patients are getting the most appropriate treatment in the right circumstances as possible. And, I think there are concerns by people, there were a lot more concerns before COVID about telemedicine, the modality there, the use of it for regular treatment. But now, with more people getting a lot more comfortable utilizing technology, this barrier is really blown wide open. And I think it's a good thing. I also think, though, that it's another separating aspect of our lives that we're dealing with. That COVID really exacerbated in isolating us from one another. And so that's what I'm so concerned about in our society and our culture, and how its long-term effects will impact not only health, and probably Dr. Shaw can speak to how isolation has such physical results, on all kinds of our health, but our mental health, our psychological health is, even in normal times, as many as 80% of kids report being lonely at some point. And now, according to a JAMA report, tripling the rate of depression because of COVID-19. It's a clear indicator that isolation exacerbates and makes worse things like depression and anxiety. And so, the last thing I want to see is another pandemic where we do this again. I think we need to figure it out so that we don't, government doesn't make things worse.
Yeah, thank you for that, Senator Barton. I think you made a couple points there. It's COVID-19 right now, but really it could be COVID-22, 23, and 24 at some point. I think there's a sense that we would be dealing with something like this. We're hoping we won't, but we will be. That's just kind of the reality that we have right now. I want to go to Joss, but before that, Dr. Shah, can you talk to us about the improvements that, the lessons that you've learned, improvements that you've done, especially in the emergency room, in terms of just treating COVID-19 patients? My wife is a nurse. I know at some point she worked at the COVID floors. What she's telling me is that, hospitals and emergency rooms, they've just gotten better at treating, like they kind of know by this point, like what kinds of, approach to take.
Oh, I mean, certainly it's just that the more we have experience with the disease and the longer time that goes, we just find better ways of organizing ourselves. I think at the very beginning of the pandemic, there was naturally some level of fear about the virus and about doctors and nurses and those of us who are on the front lines getting it and then having a negative outcome. We saw stories of emergency physicians passing away right at the beginning of the pandemic, as well as doctors in China and nurses as well. And I think that certainly set the tone for it. But as the pandemic wore on, we realized that the appropriate use of PPE was pretty darn effective. We still did suffer some losses, but on the whole, healthcare workers learned how to keep themselves safe. That's number one. The other thing that we had to set up was within those hospitals, within all of our hospitals, is appropriately getting people in without having them infect others. Of course, that's a place where everybody goes when they're sick, and keeping those things separate was important. I think the other thing is that it actually was interesting for the medical profession in a certain sense, is that we don't typically just have a brand new, like a novel disease come out of nowhere that we have to learn so much about, we have to read about, we have to stay on top of, and that we have to appropriately treat patients without that background of the medical school lecture and the professor in your head and the residency, that the training you had, a lot of this was actually done on the fly. And I give a lot of credit to my colleagues, a lot of our department directors and those that kind of lead our academic institutions and those that bring out the scientific thought. We're really good at dispersing a lot of the information pretty fast so that we could start reading and getting into how do I actually treat this patient given what they're coming in with. It's you know, we're sort of creatures of habit. We understand a disease process and then we say, okay, this is what we're going to do in all of these cases. We kind of have an algorithm in our heads. Well, that all kind of came up off the fly, you know, with basic principles still kind of there. It was unique because I was seeing patients and treating patients and giving them advice without the benefit of just a lot of experience
and hindsight. Yeah.
So now you know, now we do. I mean, I think we know how things go. We can say to people, okay, this is the expected course. You walk in with COVID, I look at your risk factors. You know, now it's second nature. So I think that all that experience and learning was a real difference between the beginning and the end of the pandemic.
Oh, thank you for that. That's, you know, that's very hopeful to hear that directly from you. Josh, I want to talk to you about the kinds of behavioral challenges that you're seeing as a result of this pandemic, and even now as we're emerging out of it. Walk us through, you know, what kinds of problems manifested themselves.
Well, I think everybody's touched on, you know, some of the layers to unpack with the pandemic that have been really challenging and that have provided some hope. You know, I think, you know, Senator Bartel, you're right. There were, you know, major challenges around behavioral health, and especially for young adults, teens, and kids before the pandemic. And I think if we look at, you know, the pandemic from a trauma-informed perspective, you know, this last year has been, I think, for many families and kids, traumatic in terms of grief, loss of social connection, dealing with the disease itself. And we're starting to see a little bit as we hear from members, as we hear from families, as we hear from providers, you know, some of the effects of that. And so, you know, from a, you know, individual and family affairs perspective, you know, we're really focusing on, you know, creating spaces and teaching and training folks that what's important right now is to be listening to members and listening to family members, and providing them spaces to connect and encouraging that connection as we move forward, and really doing that from a trauma-informed perspective. You know, in that the question you ask is not what's wrong with you and how do I fix it, but what's happened to you, and providing safe space for people to talk about that stuff. So yeah, I mean, as people come out of the pandemic, we're learning about those that engaged with technology and those that didn't, and how can we hear the member and family voice about what that experience is like, not just through the provider lens.
You know, I want to mention to you a couple stats from the Kaiser Family Foundation. You know, they have this health tracking poll, and what they've found out is that 4 in 10 adults reported symptoms of anxiety or depressive disorder. You know, 36% of the adults in this survey reported difficulty sleeping. 32% reported difficulty eating. You know, I think even more problematic, 12% of adults in this survey reported alcohol consumption or substance abuse. 12% of them also reported worsening chronic conditions due to worry and stress, and of course, stress over the coronavirus. And Joel, I want to go to you because you mentioned telehealth and its advantages, but you know, as Senator Bartel and yourself mentioned the limitations of telehealth. You know, whereas before you're interacting in person, and there's just that human interaction, the in-person interaction that makes you, I can't quite explain what it is. It just makes you feel better, which is missing when you're doing telemedicine, when there's a virtual kind of barrier, right? I mean, you're connecting, but it's also to a certain extent is a barrier. What are the disadvantages of telemedicine when you're dealing with these behavioral issues that I just pointed out?
Well, first and foremost, it's that barrier that you called out. Not having that person-to-person connection. That's by and large one of the largest disadvantages. And I think that, if we look at other things that where there are limitations to what, telehealth can do, if you look at like urgent crisis situations, urgent medical situations, that there's limitations there. And when you couple that with extreme anxiety and fear of going outside of your safe place when all of this was kind of at its peak, you had a lot of people that were not seeking out appropriate care, and that it couldn't be addressed via telehealth. So that's those are two things that really jump out. And where from a health plan perspective, what we've seen are just for example, this year compared to last year, we've seen almost the same amount, and Josh, keep me honest here, the same amount of kiddos presenting to inpatient behavioral health facilities. And we're not even to June yet, as we did all of last year. So we're starting to see some of the impacts of that, not having that super catch-all way to deliver services. That those are some of the disadvantages. And then but when you look at the situation in total, I really think that the advantages clearly outweigh the disadvantages. And had we not had that telehealth option, I think things would have looked a lot worse. But by and large, it's that ability to seek out the right modality of care when you're in those urgent situations that we still haven't solved for, other than in person. And I don't know that there is a solution, to be honest.
Right, and what we do have right now is a choice, right? So a person now has a choice, again, depending on that person's comfort level, to go in person or to do it virtually. And I think that's a big relief. Dr. Shah, I want to ask you about, you're physically in the emergency room, but I do wonder what you're seeing in the emergency room, even in other places, in terms of just anxiety and depression, and really, what are some of the practical tips that you can provide people? Well, first of all, what are the maybe symptoms is not the right word, but how do you spot when you're actually experiencing either some anxiety or depression, either in yourself or in a family member, like a child?
To start off with, I think that it's often difficult for people to become aware that they're suffering from anxiety and depression. It's kind of insidious in a way, and you may feel the need to kind of push things down or push things aside as you're trying to cope and deal with various things in your life, such as disruptions. And this pandemic was certainly one very, very large disruption to all of us in our normal lives. So oftentimes what I see in the emergency department when people are coming in with anxiety and depression is that they won't necessarily, unless they've had a prior diagnosis of it and are working with somebody, they will not say it outright. They will have trouble identifying it because they won't say to themselves, "Oh, this is what I'm suffering for." From anxiety is a state in which you produce, and depression too, for that matter, physical symptoms from something that you're dealing with inside your head. So the thing is, the body is manifesting symptoms of an illness, and it's almost there to raise the awareness of the person to say, hey, something's wrong. You know, we've really got to do something about this. I tell patients in the emergency department sometimes that panic attacks have the same symptoms as heart attacks. And it's difficult to distinguish one from the other if you yourself are suffering from that. So a lot of the question then is, okay, so what are we going to do? Well, in the emergency department, the first thing for us is to make sure that we rule out the physical causes of disease. So I have to make sure first that it isn't a heart attack. But then once we get to that point where we say, well, we've sort of looked at all of the physical causes, and we think that this might be something to explore, then we start, as I think Josh mentioned, coming at it from that perspective, that trauma-informed perspective, or from that listening perspective, and asking them, so why don't you start telling me a little bit about what's been going on, and and telling me, like, kind of how you feel about things, and what's been your experience recently, because a lot of times it can be something that is kind of like the white elephant in the room, and we haven't really focused
Talked about it. Yeah.
yeah. And so to bring a little bit of agency, focus attention to some of those things, and bring them out from subconscious to conscious, really starts opening up the discussion to getting to a better place. And a lot of times for me, I'm not a psychiatrist, I'm not a psychologist, but that's where I start guiding people into saying, we may want to get somebody else involved, and you may want to consider this as a place to go. And that's where I think we've done a lot of benefit for a lot of people, because they're almost afraid to say, could it even be? Is this something that could really be? And thanks for even opening up the option, because it allows me to then take some charge of my health and move me to someplace better.
What I'm hearing from everybody is that it's so important to talk about it. But that's the first thing that you have to do, is to be able to just openly express what you're going through, so you can talk about it. And at that point, you can rule out, potential other causes of what you're experiencing, what you're going through. But talking also presupposes that you're able to listen and spot, and you're paying attention to what's going on within you, but also with family members. Senator Barto, I want to go to you, ma'am. I want to ask you, we've done a lot in the area of mental health. For example, we passed a sweeping law just last year, the Omnibus Health, Jake's Law, to really expand access to mental health care, for example. But when you're looking at all these problems that are manifesting as a result of the pandemic, or being exacerbated by the pandemic, and we're going to continue to have them, in the long term, what in your mind, what else can the state do to really help, families, individuals, tackle these challenges?
Well, we had challenges before, as we said, but, just to put a finer point on the numbers that we're talking about because of COVID. 84% by September 2020, 11 through 17-year-olds were scored to moderate to severe anxiety, 84% of them, and 90 scored for severe depression. We saw so many more calls, double digit, 40, 60% increases in calls to NAMI and suicide helplines. And deaths apart from COVID due to substance abuse overdoses. Every state saw at least a 30% increase in overdose deaths, and Arizona had over 48% increase from 2019. We were already dealing with a lot of these, a lot of issues, having to deal with overdoses, substance use, the lack of workforce for mental health care, not only for kids, but adults, and inpatient capacity, the appropriate care for specific populations that deal with mental health. The the legislature has been focusing in on mental health care, like you said, with Jake's Law, telemedicine. We've been going in the right direction. We've been pouring focused resources into higher education for healthcare professionals to satisfy the need, because so many are going to be leaving the profession due to, retirements and all of that, with a growing population in Arizona. So, this is no time to take our foot off the pedal. In fact, this year, I think we've done a lot to continue to work in this space. There's been a lot of mental health reforms that we've passed this year that are meant to address a lot of those specific issues. One of them is the focus on the long-term psych bed capacity issue. We have to come to terms that we only have 55 beds at the state hospital. And for a population of 4.5 million in Maricopa County, that's woefully inadequate. And solving that, institutionalizing is necessary for a certain period of time for many people, for them to recover and take the next step. Well, we're doing it in jail and prison, or they're ending up homeless. And so there's a big focus on criminal justice reform from that aspect. What's humane? So we passed some legislation to do that, to fix other issues having to do with the urgent psychiatric centers that were really ignoring the current law that says that when somebody expressing psychosis is brought into a UPC for an evaluation, and they have drugs in their system, they were automatically just turned away, as if it was only a drug issue, when the law clearly says that, co-occurring diseases, including substance use disorder, need to be evaluated in conjunction with mental health. And so, these are small reforms, but important ones. And there's several others on the workforce, and we took a good step forward following what Missouri did in terms of allowing medical school graduates to actually start practicing under supervision and serving the community with a physician trainee license in Arizona. And because a lot of them, graduates from medical school, fail to match with a residency program, and then end up with underpaid positions in the community and high medical school bills, and then nobody benefits from their extensive training that they've already received in medical school, much more than even a nurse practitioner or PA. So it's a small improvement, but it adds to the plethora of other ways we're trying to address the workforce shortage in the healthcare space.
Thank you for that. I wanna talk about loss and grieving, because what this pandemic has resulted in is that we are grieving in a different way that we've grieved before. You've seen all the stories of not being able to be with your loved one when that person is severely ill or dying. I can tell you, just hearing from my wife about the stories, the anecdotes she brings home, it's kind of devastating. A person who's dying, who's not with a family member, for example, and the funeral services are truncated, very limited. We're not going through the traditions and the practices that allowed us before to undergo grief or to grieve properly. And I want to go to Josh. Josh, what are you seeing in that arena, and how do we process that?
Well, Luigi, it's really tough. I mean, I think you're absolutely spot on. I've heard a couple of times, people describe the condition of major depression as just going through a sustained period of grief, but not really knowing what you're grieving. And I think that's been a challenge for folks and families during this process, is kind of like figuring out what have I lost and how do I get it back. I mean, I think going beyond treatment, I think it's really, kind of the therapeutic value of relationships. That's really what we have to hone in on. And we have to, as Senator Bartow, you said, we have to look at people as individuals, populations as individuals, not have a one size fits all, solution to some of the challenges that you've brought up. So we have to, be able to meet people where they are, and empower providers and community organizations who are really doing things well. We saw providers during the pandemic that leaned into technology through smartphone apps, and utilized family support and peer support through those apps, and it was wildly successful. We also saw other organizations that early on in the pandemic were trying desperately and did figure out a way to get people together in person, socially distanced, masked up, meeting outside in high temperatures because that's what their community needed. So it's really figuring out, how are we, kind of providing those spaces and encouraging people to connect with providers who can share their experiences, and really lean into those best practices. I think that's how you start to help people recover. And I think that, that's one of the key messages that we see every day in the people that we work with, and the providers and community organizations and families that we see, is that recovery is absolutely possible. And so we lean into that, but we also learn from each and every person's experience along the way.
I want to go to Joel in a little bit, but I want to ask Representative Shaw. It's not only the patients and their loved ones and their family members that have to go through this grieving process differently, but healthcare workers deal with this very difficult situation on a daily basis. And I was wondering if you can share your experience and how you yourself are approaching this grieving process.
I think for us, you touch upon some great points, by the way. I'm so glad you brought up the grieving point. We had some literature from way back when talking about loss and how, when, for example, somebody comes in, this is prior to the pandemic, somebody would come in and let's say they had a cardiac arrest and they were in the back. We had some literature way back when that showed that when family members were allowed to come in and visit that person who was in the middle of a code during the code, and at least see that their family member was being worked on and that there was an effort, and that we were all there working on that person, and they were just able to be there for that person just for seconds or minutes, that helped those people cope with what was going on, because it's that feeling that we are there for our family members. I mean, this is a human value, time immemorial. And I think that this pandemic specifically caused isolation that didn't allow us to grieve in the way we've always grieved for our family, our friends, and to honor those bonds of relationship that we have with one another,
and grieve in a way that worked, right? I grieve in a way that works. We didn't have that.
We didn't have that. I mean, and so the family members didn't have that. The patients themselves were very lonely, sitting there, with their cell phones in the rooms. We did, for a long time, we didn't have visitors in the emergency department. So somebody would be there and they'd be in a lot of trouble and they'd be scared, and you don't have somebody holding their hand. I mean, I tell you myself, like how painful that was. And so, and for us too, it's not as if we were told to minimize contact. So it was hard for us to go in there, and ordinarily we'd be the source of comfort for some of those people that didn't have somebody that was right next to their bed. But the same is true for us. I mean, as healthcare workers, we also absorb a lot of that. We're there for people, and that's a job we chose to take on. We it's a point of pride for us to be there for those people. But then, we also rely on others to be there for us. I think anybody who like such as yourself, who is married to a healthcare worker, also knows that we come home and we're able to talk to our family and friends about what we see, these very heavy emotional kinds of experiences. And it's a natural part of being of sustainability, of being able to continue to do our jobs every day. Well, that was also lost, as you said. So we I go home every day, and I for like a year straight, I was just by myself. And of course, same thing like this. I'm talking to people over Zoom, my friends, my family, but it's hard. It's still just a hard thing, because that barrier that we talked about earlier was still there. So I'm glad you brought this up as a point. I think once again, the theme is that if we can shine a light on it and talk about it, then we can start to make people feel like they've been able to express themselves and process it.
Thank you for sharing that, Dr. Shaw. I have just one practical question for Joel. Let's say that I'm undergoing through either anxiety or depression, or maybe I'm turning to wine every night, or I'm seeing problems in my kid. What do I do? Who do I call? Where do I go to?
Well, first and foremost, that ability to recognize that that stuff is happening is a gift, because often that stuff manifests itself, and before you know it, you're way too far into it. But I think it's critically important to be able to recognize those kind of signs and symptoms. If you're looking at, you're talking to your kid and you're noticing that they're becoming more and more isolated, if you're noticing mood changes, if you're there's a myriad of avenues you can pursue, whether it's contacting your PCP, contacting that mental health number on the back of your insurance card. Or in Arizona, we're incredibly fortunate to have crisis lines that are available 24/7 for that brief crisis intervention and referral. So I think it's a matter of knowing your resources and not being scared to ask those questions. Whether it's asking a neighbor, sometimes when you're in the thick of it, you feel like there's no one else out there, and it's just being able to ask those questions, and then really just take advantage of what's available. A lot of times when things are going south, folks don't always think, maybe I should just call my doc and talk to them, and because 9 times out of 10, your primary care doc is going to be able to pick up on something and say, hey, it sounds like maybe you need to talk to someone. But again, fortunately, if you're, if that's not something you're comfortable with, we do have the crisis lines where you can remain anonymous, and you can say, and you're going to talk to a trained crisis specialist who's going to be able to kind of assess what's going on and help you take those next steps. So it's really just about kind of knowing your resources. I know that our plan, we try and broadcast far and wide that these crisis services are available, and I don't think we're unlike any of the other health plans in the state. So it's really just taking advantage of those things that are at your fingertips and asking those questions and not being afraid to ask those questions.
So what I'm hearing is that if you feel like you're undergoing through these problems, or if you spot it in your family members, don't hesitate to go call a number, talk to people. And it's important to talk to people so that if you're not able to do it yourself, they can help you, get connected with the right people, and just to really just express yourself. It's so important to just talk to people, express yourself, and don't hesitate to find the help that you need. I'm going to go to some of our audience questions because we're running out of time. Here's a question from Becky. Do you see telehealth expanding as a mode of treatment in the future? Is there a cost saving from using telehealth? Well, of course, still acknowledging that there are certain things that absolutely require in-person treatment. I want to pose this to Senator Bartow.
Well, I think we've covered that a lot in this conversation. I think, you know, just, I think, yeah, I mean, it's going to be expanding tremendously. But I think there are certain populations where it's not appropriate. And I guess I kind of wanted to get into, acknowledging some of the families who are continuing to grieve because of the loss of this whole year, of not having that connection, of the business owners that lost their businesses, and there's very little compassion for them, going through that. It's almost like stigma, for I think, kind of lack of humility by by public health, that we have all the answers. And I think we are going to be analyzing this for years and seeing how we could have done better. We always have held up prevention and early treatment as great ways to prevent greater disease and trauma, and we failed at that with this to a large degree. And so, I think we certainly could have done better on a number of scores, because we didn't acknowledge the grieving of the elderly who were isolated from their families and suffered the physical consequences. I know, our family did. My cousin lost her 100-year-old mother and wasn't able to be with her, in an assisted living. We actually passed legislation that worked on visitation, because this is so important, as Dr. Shaw mentioned, for patients inpatient to have that part of their that necessary part of their health care met is through interpersonal relationships, through the family. There's so much, the DD population who, couldn't go to their day treatment programs. So many regressed. There's a ton of things that just can't be satisfied by telehealth. Much can, and thankfully has been, and will continue to meet many needs. There's just so much this conversation that, I think points out how human we are.
Right.
The failings, the inadequacies of government to solve issues. We did great in terms of a lot of things, getting out the vaccines in record time and getting them distributed, the PPE, just incredible, healthcare workers working overtime. But there's much that needs to be discussed in the future to acknowledge some of the things we may have really dropped the ball significantly on.
And if you could just stay just for 1 minute, I want to ask Josh and Joel to share a little bit about the PROs and the FROs? Just very quickly, I guess, Josh, if you can tell us what it is about. And this is obviously a program to combat, isolation.
Sure. So the PROs are peer-run organizations, and FROs are family-run organizations. We have a group of providers in our networks that are absolutely critical, that provide supportive services, and they're run by, and the services are provided by people who have been there. And that's the gist. And they performed incredibly during the pandemic. And adapted to a really challenging environment. Again, all about connection and relationships, keeping patients and members and families at the center of our view, not just services provided.
And with that, I think that's a good place to end. Senator Bartow, Joel, Josh, Dr. Shaw, thank you again for your time this morning. Thank you to our viewers and listeners for your time. I really appreciate your spending your morning with us, and of course to Molina Healthcare for sponsoring this morning scoop. And with that, I should say goodbye and enjoy the rest of your day.
Thanks, Luigi.
Thank
Thank
you,
you,
Senator.
Great day.
Thanks, Dr. Shaw. Thanks, Senator Bartow.
Okay, thank you both.
Glad to